So it's my pleasure to introduce our first speaker, Dr. Stephanie Hoops. Stephanie's the National Director of United for Alice. She leads the National United for Alice movement, having shepherded the growth and success of United for Alice from a local pilot study in Morris County, New Jersey, to really this nationwide initiative with data for all 3,000 U.S. counties and partners in more than 30 states. So Stephanie's going to set the stage for us today. And Stephanie, I'll turn it over to you. Thanks for being here today.
Oh, thanks, Matt. It's great to be partnering with Aspen, and we've been rowing in the same direction for quite a while. So it's really exciting to be here together. Want to thank you for posting some of our links on your resource page on your website, and I think that we're both thrilled that our partner Shira Bennett is one of your fellows and is here today. So a lot of overlap and looking forward to the conversation. So let's dig into the data that sets the groundwork for this, and then we're going to be talking about some of the action that's happening to make a difference for Alice workers. So asset limited, income constrained, employed are workers and families struggling to afford household basics. Think about the workers who help keep our economy running smoothly and actually, help keep our lives running smoothly. You've probably run into several Alice workers today, perhaps getting a coffee, dropping your child off at childcare, traveling on public transportation, stopping in at the bank. So many people that are performing important jobs in our economy, yet struggling to support their own families. And as we talk about the data, think about these people, and actually many of them are closer to home. Friends, family. Certainly for me, I have two young adults starting off in the work world, and they're having a really tough time finding a rental apartment that they can afford near their job. And many of us have parents who are trying to retire and don't have those savings and maybe challenged in an Alice where their Social Security isn't enough to support those household basics. So next slide. Let's dig into the data. And here you can see a breakdown of all households in the US by income. The dark blue are households in poverty. And that's our official measure. With that, 13% of households are struggling. Yet, when you look at what it actually costs to live and work in every county in the country, we find another 29% of households are struggling. So our official measures are not telling the full story. In fact, 42% of households are struggling. With those kinds of numbers, of course, we all know Alice. And it gives us a sense of the magnitude of what we're trying to address here today. Just a little bit behind our work, we are a national research organization. We do innovation around Alice and measures and financial hardship. But one of the unique things about us is we're housed at United Way of Northern New Jersey, and it's very important to us that our work is useful on a local level. And you'll see that as I go through some of the measures. Next slide. We see Alice lives in every community across the country. So there's a big range by state. The lowest percent of Alice households is 33% in North Dakota. The highest is 50% in Louisiana. But Alice is in every county, in every local community as well. So our data is available at the county level, zip code, county subdivision. And so you can really find out more about your local community as well as this big picture across the country. Alice also comes in all shapes and sizes. We have all ages, all race ethnicities, all household types. So there's no one Alice picture. And I think that's important to recognize when we're looking at solutions. There's no one problem and there's no one solution. It's going to take a lot to change the trajectory of 42% of households. Next slide. This is, I think, the epitome of our work. It's an example, but I think it shows the crux of the challenge. The dark blue column is the Alice household survival budget, and it's what we calculate for every county in the country, just the bare minimum for housing, childcare, food, transportation, healthcare, and then Alice pays taxes. So this example is a family of four with two children in childcare in a, kind of the median income county in the country, Duval County in Florida. And we compare that with the yellow column is two of the most common occupations. So this family, four people, two adults, they're both working full time, year round. One as a personal care aide and the other as a stock worker order filler. So super common jobs that we all know. They don't earn enough to support just that basic household survival budget for a four-person family. And it's that gap is why we have so many Alice households. You can see this compared to the federal poverty level, which is the gray box, and how woefully short that is of what it actually costs. So next slide. And I just want to point out, so we have that budget everywhere. And so as we're talking today, the cost might be slightly different in DC or Arkansas or Tennessee or New York, but so are wages. And so it's comparing the two in that location that makes such a difference. And what we're seeing across the country is over the last decade and a half, the number of households in poverty has remained flat, while the number of Alice households has continued to tick up. And that, again, is worrying for our whole economy. At what point can economies support so many households that aren't, purchasing beyond their household basics, that are struggling with their daily existence beyond, what it takes to make an economy grow? So I think that we are concerned about Alice families as individuals, but we also need to be concerned about the bigger economic picture. Next slide. So we've been talking about Alice households overall and shifting here to really dig into Alice workers, which is the focus for this webinar. And in this example, we see that some of the most common occupations, we pull these out for each state. You can see the number of employment, but then what percent of those workers are below the Alice threshold. And you get a sense of why when you're looking at their hourly median wage. Next slide. So we currently have, excuse me, those occupations for occupations. We're also in our next data that's going to be released, we'll show them by industry sector, which I think will also help us understand where Alice is working, and not to steal our punch, but Alice does work in all sectors. So more to dig into. And with our next slide, I wanted to leave you with a few things to check out after the webinar. We have a great website where you can dig into more data on your state. You can get demographics, data over time, more on the workforce. Next slide. And we also have some terrific tools. Things like our Alice Income Status tool is very handy for looking at eligibility for programs. We have a legislative district tool. I know many of you do advocacy, so that is useful to drill down that Alice lives in all voting districts, state and federal levels, so you can dig in more there. And then next slide, with your interest on, I'm talking faster than my slides. So there's the income status tool and the legislative district tracker. And then on the next slide, we have the economic viability dashboard. And one of the features on that is a deep dive into Alice data for workers. So I invite you to check that out. And one of the features of the tool is not only the Alice data, but pairing it with promising practices. And we know that that's so important as we're defining the problem, what can we be doing for next steps? And today is where we're really focusing on those promising practices with Alice at Work. And this has been a dream of mine for a while. So it's amazing to see it coming to life because employers are one group that can make the biggest difference for Alice, and they can make it so immediately. They don't have to wait for it to be passed by the legislature. They don't have to wait for it to go through committee. And so it's things that sometimes it's increasing income for Alice households, but sometimes it's changing practices that just help decrease costs. And so it can be as simple as changing scheduling so that a worker doesn't have to pay for extra time at childcare or can use public transportation. So this is just to get you thinking of all the different creative ways that employers can make a difference for Alice after recognizing that they're in the workforce. So thanks, Matt.